Welcome to the Get Well podcast. I am Dr. Kevin from Dr. Kevin's Wellness Clinic in Lafayette. This podcast will bring you the latest in functional wellness and bring you some of the latest research in an alternative to the status quo medical system that we have today in America. Functional wellness means how can we get your body's systems to begin to function better? Your cells are designed to perform a certain function. A thyroid cell makes thyroid hormone. An insulin cell makes insulin. A stomach cell makes acid. Your nerves transmit signals, and on throughout your whole body. And if that's not happening, there has to be something causing that. If you go to the doctor and he says, well, your thyroid just quit working, or sometimes your gallbladder just quits working, and that's not something that just happens. Your organs don't just go on vacation or go on strike for no reason. And so it's also ridiculous to remove those organs when you could have possibly gotten them working again. It's like you take your car to the mechanic and he says, well, your brakes weren't working, so I just removed them, just took them out. You'll have to stop like Fred Flintstone from now on. Guys, if your organs are malfunctioning, there has to be a reason why that's happening. American healthcare really is just backwards whenever it comes to this. We now take 50% of all the pharmaceutical drugs on planet Earth, yet we are only 4% of the world's population. We have more doctors and hospitals than any other country on the planet, yet China and Cambodia have a longer life expectancy than we do. As a matter of fact, we actually ranked 26th. So if the answer to living a longer life, a better life, was doctors, drugs, and money, we would be the healthiest nation on the planet. We have to begin to include functional wellness as part of our healthcare paradigm. I really feel, ladies and gentlemen, like that's the missing link. And when it comes to chronic problems and chronic disease, things like autoimmune, diabetes, arthritis, hormone problems, the American healthcare system really struggles. They're brilliant at acute care and trauma stuff. But if I ask you, name a chronic disease that we've cured in the last 50 years in America, go. There's no such thing, right? Crickets. And so whenever it comes to chronic problems, chronic diseases like autoimmune and diabetes, that's more of a functional wellness problem by nature, meaning your body isn't functioning right, and we need to figure out why it's not functioning right and treat that. I know it's a novel concept. So I wanted to open with what is now one of the number one reasons that people visit their doctor, and that is complicated digestive problems. The truth is, guys, our digestive systems in America are a complete mess. And I'm going to explain why that is today. But the vast majority of people out there have some sort of a reflux or IBS or Crohn's or UC or GERD or maybe multiple problems. And if you get one thing out of today's show, let it be this. If you're going to have a healthy person, you have to begin with a healthy digestive system. You cannot have a patient with an unhealthy digestive system and get them healthy. You can't have an unhealthy digestive tract in a healthy person. It just doesn't work. So if you have digestive problems, you're going to develop worse problems down the road. Some kind of a chronic disease, no matter how much you ignore it or cover it up with medicine. If you're going to have a healthy patient, we have to restore the patient's digestive system first. Otherwise, you're not going to get anywhere. So this is one of the most important points. 80% of your immunity begins in the gut. Serotonin, which is one of your brain's main neurotransmitters, is made in the gut. So that explains a lot of these mental issues and stress and digestive and anxiety issues is because that's made in the gut. The thyroid hormone is partially converted in the gut. So there's so much responsibility that the gut has with the rest of our health that you can't separate the two. So today we're going to get into IBS, reflux, GERD, and all of these complicated digestive issues that are occurring. And I'm going to save Crohn's until next time because Crohn's is directly an autoimmune reaction, which is a whole different ball game. Now, if we start with IBS, IBS stands for irritable bowel syndrome. Now, I'm a pretty common sense doctor. I'm a straight shooting guy, with my patients and with my audience. So does it make sense that if a patient has irritable bowel syndrome, that some effort should be made at some point to figure out what's irritating it? Am I the only one that makes sense to? Yet that's not what happens. What happens most of the time is prescribe medicine, prescribe a different medicine, and then scope and then cut part of your colon out. That's just sort of what we've got. And Americans deserve so much better. Let's see if we can figure out what's irritating the colon in irritable colon syndrome. Common sense stuff. So if we start with reflux, let's see why the food is refluxing. If we have constipation, let's see why the colon isn't functioning. And it all makes common sense. And common sense is something that we could use a lot more of in our healthcare system. Now, your digestive system is all about balance. And if things get out of balance, then the end result is going to be digestive disturbance. Getting your system back into balance is very important. It could be the stomach acid is too low. Yes, I said too low. It could be leaky gut. It could be the pH of the body is off. It could be bad strains in the bacteria of the bacteria in the biome. And honestly, it's probably a combination of all of these things because the gut is all about balance. And that's so important. And that doesn't mean just taking a handful of probiotics every day and hoping for the best. New research proves that probiotics may help you feel better short term, but they can actually make you worse over time. They can further throw your system out of balance. And so the problem with probiotics is that this short-term benefit can actually affect the long-term health because you're not regrowing anything. People take probiotics thinking they're going to regrow bacteria, and the new research shows that just isn't what happens. There is a protein that's released from these probiotics that can give you short-term benefit, but you're not regrowing anything. Otherwise, you could take them for a few weeks and be done. But that doesn't happen. You have to continually take them because it's like a Band-Aid. You're not actually regrowing or improving the health of your bowel with probiotics. So to figure out the reason that your bowel is in a state of irritation takes proper testing. You can't figure all this out in a 3-minute office visit. And that's why we don't do 3-minute office visits at my clinic. We don't rush our patients in and out. We spend the time necessary to solve issues. Now, regular doctors can't do this because, to be honest with y'all, they're playing the insurance game. The insurance game is rush them in and rush them out, high volume, bill high to collect low, next patient, push them through. That game is not a good thing. Where does that leave your health? It leaves us ranking 26 in the world in health and having the most expensive healthcare system in the history of the planet. That's where it leaves you. But anyway, I digress. Let's talk about these bacteria in the gut. Now, the bacteria, there are hundreds of different strains of bacteria that are in your gut or that are supposed to be in your colon. And each one of those strains has a different job to do. So one may break down proteins, One may break down sugars or carbohydrates. One may release enzymes that are beneficial for you. One may create immune system factors that help you build your immune system. But all of these hundreds of strains of bacteria all have to be in balance and working normal. Probiotics can't do that. Probiotics are 11 to 14 strains at the most. There are hundreds of healthy strains. There are also hundreds of harmful ones, like E. coli is the one that everybody knows about, but the truth is there's many more. Some of the harmful bacteria feed off of the good bacteria and destroy them, and vice versa. So understand, this is like a small war going on inside your colon. I know sometimes it feels like that. But the good bacteria and the bad bacteria battle for space. They battle for who's in dominance. And every one of these bacteria releases something into your body. They excrete things. Now, some of the helpful bacteria may excrete things that are good for your body. That's why they're called good bacteria. And some of the bad ones may excrete things that are harmful to your body, and they make you sick. They rob you of your energy. They give you irritable bowel syndrome. They give you food poisoning, for example. So when you get food poisoning, it's not the bacteria that make you sick, it's what they release. It's the toxins that release. That's why you don't notice it for 12 or 15 hours. But these bacteria release things into your body. There's one called disulfovibrio, which consumes your healthy bacteria and releases a sulfur gas. You can only imagine how bad that is to your system. So how do we know what these strains of bacteria are? How do we know what you have in your digestive tract? Outside of just guessing, which doesn't work, but that's what most people do. We need to know exactly which species you have and the amounts are there and who's fighting who. We need to know what the story is of this war that's going on. Now, the old medical way of looking at this, if they even looked at it, is they would do a culture, which means they take a sample of your bacteria and they grow it on a petri dish in a lab. And then a couple of days later, they look and they identify those strains of bacteria and they tell you what's in your colon. New literature proves that culturing bacteria can miss 70% of what's actually in your colon. So we're looking at 30% of the picture back then. I now have a lab that can DNA test every strain of bacteria in the digestive tract from one end to the other. And the reason DNA testing is so critical is because you get a list of 100% of every single bacteria that's present. You don't miss that 70%. And most people don't understand, even with something like E. coli, there's 4 or 5 different strains of E. coli, and some of them are perfectly harmless. There's other strains of E. coli that could kill you. So if I culture a sample and tell you you have E. coli, that doesn't really tell you a lot. Do I have the harmless one or the one that could kill me? But if I can DNA test all of these bacteria in your digestive tract, I know the exact genus and species of that bacterial strain, and they can be tracked for which one is more important and how all of this balance lays out. And we get this beautiful 7 or 8 page report with pie charts to show the balance and the toxicity of all of the strains of bacteria that you have in your digestive tract. And then and only then can we begin the difficult work of trying to balance each one of these harmful strains of bacteria. Now, my second point with these harmful bacteria that are damaging to your gut is if you have something called leaky gut syndrome, it gets even worse. So let's stop and talk about this leaky gut syndrome, because I know many of you may have heard that term before. Some of you may not, but most people don't fully understand the ramifications of having leaky gut. So let me take a few minutes to see if I can describe what that means. So the food that's in our digestive tract, when we swallow food, that food is supposed to stay in our digestive tract and be broken down into nutrients. before it crosses that barrier and gets in your bloodstream. So if you eat a salad, that salad should be fully digested and broken down to its smallest component. Well, salad breaks down to lettuce, lettuce breaks down to carbohydrates, and carbohydrates should then trickle into your bloodstream to be used to make energy. That's what nutrition is. Only nutrition, only the smallest nutritional component gets in your bloodstream. Now, if I eat a salad and I get chunks of lettuce crossing into my bloodstream early before they're turned into carbohydrates, that's called leaky gut syndrome. And it is extremely inflammatory. Your food is getting into your body, into your blood undigested. So instead of carbohydrates and protein, you're getting chunks of lettuce and chunks of meat and chunks of chicken past your digestive wall too soon. And this is something that is very irritable to the bowel. It also irritates the immune system. It creates all kinds of inflammatory response. So if you're listening and you have digestive problems, you need to know if you have this. Many people have never even been tested for it. But the barrier between what you eat and what gets in your bloodstream has become leaky. It's become too porous. It's not keeping the bad stuff out of your body. Now, I can comfortably say that everyone within the sound of my voice has some degree of leaky gut syndrome. That's how common and severe this has become. And the reason that I can confidently say that is because it's now been proven that pesticides and herbicides, and especially Roundup, destroys our gut lining. Now, Roundup that they spray on weeds, like you spray weeds in your backyard. But glyphosate, which is the main ingredient in Roundup, has now been proven to rip through our gut lining. And Roundup is now in everything you eat. If I took 10 of you and I tested 100% of what you've eaten this month, I could find traces of Roundup in 100% of it. There's even traces of it in the organic foods that I eat. It's obviously better. There's way less of it, but it's still there. Roundup and glyphosate are now in 100% of the water you've drank this month. They spray it over our houses. The farmers all around Louisiana spray it everywhere. And glyphosate can destroy the lining of our digestive tract. So we don't say this is something that's ever 100% fixed. You have to manage this over time or it's going to come back. And then we have the whole subject of stress. Stress dramatically affects how your digestive tract functions. Now, it can be stress, whether it be work or traffic or the bills or the spouse or the kids, you name it. But stress puts us in this physiologic reaction of fight or flight response. And when our bodies go into fight or flight, there are over 50 different mechanisms that take place, and I'm going to tell you the top 4. The first thing that happens when I get under stress, because my body thinks I'm going to fight or run, is my blood pressure goes up. The second thing is it takes the blood from my digestive system and it moves that blood in my arms and legs so we can fight or run. So I don't need to digest my food. I'm fighting for my life. My sleep hormones aren't produced very well, and then my cortisol levels rise. Cortisol is an inflammatory weight-storing hormone. So the body's response to stress is to shut down digestion, to turn off acid production. People think they have overactive acid pumps in their stomach. And in most cases, it's actually the opposite. See, over the last 40 years, we've been sold that our acid pumps are overactive and that we have too much stomach acid bubbling up in our esophagus. And of course, what do we need? We need that purple pill. We need to take that Prilosec to be healthy. We now know, just not true. Most people likely don't have enough stomach acid. The body's response to stress is to lower acid. Your stomach acid also lowers as you get older. It lowers digestion and shuts off acid production. Now, the reflux that most people feel is their undigested food making organic acids that's off-gassing and bubbling up into their esophagus. So if you've ever thrown food into the garbage can in the summer and you go out there the next day and look, there's like a pool of liquid under it. Those are the organic acids from that food fermenting and food rot. And that's likely the reflux that you feel. You don't have enough stomach acid, your food doesn't digest well, and it ferments and off-gasses organic acids that bubble up into your esophagus. The medication makes you feel better because it just pushes that undigested food on down into the small intestine. And the problem with that is that ball of food going into your small intestine doesn't have the proper acidity. And the danger there is you can develop another issue called SIBO, SIBO. That stands for small intestine bacterial overgrowth. And what that means is that all of the bacteria that are supposed to be in your large intestine have now worked their way through the valve and have set up in your small intestine and are growing there. So you have small intestine bacterial overgrowth. The bacteria designed to be in your large intestine are now in your small intestine. And when they produce gas in the small intestine, there's nowhere for that gas to go. So these patients feel very bloated and their stomach is swelling and it's very painful after everything they eat many times. They can't really find anything they eat that helps them very much. And one of the main reasons this happens is we can back all the way up to the stomach and that person's probably on some kind of a stomach pill for their reflux. So it's very important if this is happening that we have to fix the digestive system all the way down the line. SIBO is just a miserable condition to have. Now, we have a unique approach to solving this, and it really starts further upstream. But unfortunately, most of the time, SIBO is not even tested for. The lab that I use to test for SIBO, pretty neat. It uses breath analysis. So they can actually pick up the presence of these bacteria in your breath because as that gas backs up, it will actually come out and they can detect it in your breath. Now, there's a lot of other things that can cause IBS and digestive disturbances that I didn't even have time to go over with you. But everything that I've talked about today can't be seen through a scope or a blood test or any of these other traditional medical tests. And the thing that's done with a scope is they scope your stomach, they scope your colon, they run cameras all over because that's an easy charge for them. But it rarely shows the things that I've discussed here today, which, by the way, are the most common causes of digestive disturbances. People deserve to have an expert sit down with them and take the necessary time to figure out all of the individual pieces of the puzzle that has led them to have a destroyed digestive system. And then we can sit down and devise a plan of how we're going to solve these things in a very methodical, common sense way. And that's what we do right here at my beautiful new office behind Women's and Children's Hospital. Thank you for joining me. Please make time to tune in next time when we have our second podcast. And if any of you out there are struggling with these complicated digestive issues or any other health matter, you're welcome to call my office and set up a time that we can sit down knee to knee and see if my methods might be able to help you. Thank you for joining me. I'm Dr. Kevin. We'll see you next time.